I've been involved with CyberKnife here at Winthrop for approximately 5 years.
At the University of Pittsburgh, for over a 10-year period now, we've treated over 200 patients with the CyberKnife system for lung tumors. The CyberKnife system is very well suited for the treatment of early-stage lung cancers, ones that we traditionally would be treated with surgery. The reason being, compared to conventional radiation, it allows us to give an extremely high dose of radiation, which is much more effective, and it also allows us to do minimal damage to the surrounding lung parenchyma, and that it's so well tolerated that we found that we can safely give it to these patients with advanced stage comorbidities, severe lung dysfunction, and have them tolerate it very well.
The lung can't remain still, and this is where CyberKnife has really aided us in the tracking of the lesion with respirations.
The Synchrony tracking system is the system that the CyberKnife radiation system uses to accommodate for respiratory motion. Rather than administering the radiation during a certain phase of respiration, or rather than making some attempt to suppress the respiration, the CyberKnife system allows radiation to be delivered through the respiratory cycle through a fairly sophisticated system.
By monitoring the motion with respiration, the radiation is not scattered during the treatment process. It stays aimed at the tumor itself and avoids injury to surrounding structure and has the maximum dose of radiation to the neoplastic lesion.
Now with CyberKnife we can do it without the placement of any fiducial markers. It's completely non-invasive.
The usual course of treatment is anywhere from 3 to 5 days. In the old days with standard radiation, it would be 5 days a week for 4 to 6 weeks, which is very time consuming. Each treatment was shorter, but it was the travel to and from the hospital and putting that time aside for both the patient and whatever family was dealing with that.
It's been very gratifying now to see some patients with no sign of residual disease that are still out and very functional and enjoying a good quality of life.
CyberKnife has positively impacted our practice in that we do see more patients. But I think the major issue is we've been able to help more people. I think that's the goal.